Hi, my name is Vaishnavi, and today I'll be presenting you with our Ready Set Baby training, a guide to welcoming your new family member that we provide here at the Women's Health Education Center at UNC Hospitals. We'll be going over today some of the most important things that we do at UNC Hospitals in order to ensure a healthy birth and a healthy mother and baby. So, we practice skin to skin contact, rooming in, feeding on cue, as well as encourage early and exclusive breastfeeding, and I'll be providing you with some breastfeeding tips, including position and latch, and discussing some benefits of breastfeeding for both mothers and babies. So, let us begin with skin to skin. Our skin to skin philosophy is that mothers and babies belong together, which is why we encourage you to practice skin to skin, so touching your baby's skin to your skin, early and often. So we encourage you to ask for your baby to be placed skin to skin with you right at birth. Skin to skin means that the mom or the caregiver is holding the baby so that her bare skin is touching the baby's bare skin. The baby can wear a diaper and a hat if you would like. Most babies are then ready to nurse within the first 2 hours of skin to skin. Skin to skin has some important benefits. It helps the baby adjust to life outside the womb. Skin to skin time helps to steady the baby's heart rate and breathing. It also helps to keep the baby's blood sugar up. And the mother's body heat will help keep the baby warm as well. Additionally, skin to skin can also make breastfeeding easier. So, being held close to the mother for long periods of time can also help promote bonding between the babies and the mother, as well as the partner and the babies. So we encourage skin to skin early and often here at UNC. So in addition to practicing skin to skin, we also practice rooming in order to keep mothers and babies close. Rooming in means that the baby and the mother will stay in the same room during their hospital stay. Mothers and babies should stay together unless there is a medical problem. If there is a medical problem, we plan to have another adult stay with you in your hospital room. Some benefits of rooming in include it helps you learn your baby's feeding cues, it helps your baby sleep, rooming in helps you get more rest, and it makes it easier to have skin to skin time, which I have discussed as being very important for your baby's development. Rooming in can help your baby grow well from the start. It's normal for babies to lose weight in the first few days of life. It also makes it easier to breastfeed your baby more often, and it helps breastfeeding moms make more milk faster. Rooming in ensures that your baby is getting the care that you want, for example, no pacifiers or bottles, and rooming in helps the mothers feel more confident about caring for your new baby. With the exception of circumcision, if required, all other medical care will happen in your room, including your baby's first bath. This gives you time to ask questions and learn how to take care of your baby. Babies are sometimes born with a creamy substance on their skin. It's called vernix. This cream is actually good for the baby, and it's best to wait until the baby is at least 24 hours old before you decide to wash off the vernix. You may also decide to go home before you give your baby their first bath. So, rooming in also has the benefits, as I've mentioned, of you learning your baby's feeding cues. This is another practice that we recommend at UNC called feeding on cue. Feeding on cue, or feeding on demand, is when you feed your baby whenever your baby shows signs that he is ready to eat. It also means that you stop feeding when your baby shows signs that he is full. And here are some hunger cues and fullness cues that can help you understand these signals. Feeding when your baby shows signs of being ready is one of the best things for you and your baby. If you're breastfeeding, this helps you establish a good milk supply. Remember, babies can't tell time on a clock, so they convey their feeding cues to you based off of what they're feeling. Another phrase for feeding on demand is cue-based feeding. Cues are the baby's language to let us know what they need. Babies use cues to signal when they're tired, they need to be changed, and they want quiet time. Learning a baby's language is a new skill for all parents. So, some benefits of feeding on cue are that it helps your baby feel safe, and new babies feel safe when their needs are met. Feeding on cue also encourages healthy growth. Babies are born knowing how much they need to eat for healthy growth. Your baby will eat best if you follow his lead. If you put him on a schedule, he may not eat as well, and you could slow his growth. Your milk supply also depends on your baby. The more milk your baby drinks, the more milk your breast will produce. This is most important in the first hours, days, and weeks of life. This can be exemplified by newborn stomachs. Newborn baby stomachs are very tiny. They start out about the size of a grape. They have to eat tiny amounts and they eat many times a day. As your baby grows, they will go through growth spurts. Growth spurts happen around 1 to 3 weeks, 6 weeks, 3 months, and 6 months of age. During growth spurts, your baby will want to eat more often. These frequent feedings will help your breast to make more milk. Follow your baby's cues to make sure that your milk supply keeps up with your baby's changing needs and so that you do not overfeed your baby. Feeding on cue can also help mothers and babies bond. When you respond to your baby's cues, you build trust and a healthy bond. He feels safe knowing that his needs are going to be met. Babies who are fed on cue grow to be more confident toddlers also. So, you may be wondering how to feed your baby on demand. Every baby is different, but here are some common signs that babies will use to tell us that they're hungry or full. Over time, you will learn your baby's signs. So, here are some hunger cues that your baby is ready to eat. Your baby's eyes may flutter, or they may move under closed eyelids. Your baby may suck on their tongue or their hand. Your baby may stick out their tongue, be more alert, or exhibit this rooting behavior, which is when they open their mouth wide and turns their head. Crying is a very late stage of hunger. If you wait until your baby cries to feed them, they may be too upset to eat. You can try holding them skin to skin and belly to belly to calm them down. You can also gently rock your baby side to side and wrap them in your arms, holding them close in order to encourage feeding. So, babies also have fullness cues, which is when they would like you to stop feeding them. So some cues include that the baby will look relaxed, their eating will slow down, they will stop sucking, or they'll turn their face away from the nipple. Or the baby will close their lips when the mother offers her nipple. The baby will also become more aware of their surroundings and sometimes even fall asleep when they're full. Check in with your baby by burping and then offering them the same or the other breast. If your baby continues to show these signs, then stop feeding them for now. As a note about pacifiers can hide cues that your newborn baby is ready to eat. We encourage you to avoid using pacifiers until breastfeeding is going well for you and your baby. So, now that I've discussed breastfeeding, I'd like to mention another practice that we encourage at UNC, exclusive breastfeeding. Exclusive breastfeeding means that your baby gets only your milk directly from your breast or from expressed milk. It's recommended that your baby receives only your milk for the first 6 months. Your milk has everything your baby needs to grow. The milk your body makes changes according to what your baby needs. As your baby grows, the amount of milk will increase to meet the needs of your baby. Many health organizations recommend breastfeeding your baby for at least 12 months, even after introducing solid foods. There are lots of benefits for both the mother and the baby due to exclusive breastfeeding. For the baby, the mother's milk is full of special things for your baby, like vitamins and antibodies to fight off germs. In the early days, your baby can get a little bit of colostrum, which is the first milk. At each feeding, your baby gets just enough to fill their small stomach. Your milk changes as your baby grows. It has everything that your baby needs to grow strong and healthy. Breast milk is also easy to digest. This means babies have smaller, softer stools that are easy to pass. Your milk can also fight diseases. The infection protection in your milk is unique and will grow dynamically with your baby. For the mother and the family, the milk is convenient. It's always warm and ready, and your baby can eat whenever they get hungry. Breastfeeding can also save money. There's nothing to buy or prepare, and formula can be expensive. Breastfeeding can release hormones to help the mother relax. Breastfeeding can also help to lose weight, and it can be good for the mother's health as well. Moms who breastfeed recover from birth faster and have a lower risk of type 2 diabetes, breast cancer, ovarian cancer, and osteoporosis. These are all facts based on breastfeeding compared to feeding from formula. So, now that I've gone over some of the benefits of breastfeeding and that we encourage exclusive breastfeeding here at UNC, you might be wondering how to get started with breastfeeding. So, We encourage you to breastfeed as soon as possible after giving birth. We also encourage you to ask for a nurse or a lactation consultant to help you with feedings, especially if you're not 100% comfortable yet. And we encourage you to avoid your baby feeding from bottles or from pacifiers for the first 4 weeks. So, in order to feed your baby, you will need to understand how to position and encourage your baby to latch. Positioning and latching your baby will take some practice. The nurses and lactation consultants can help you learn what's comfortable for you and for your baby so you can reach your breastfeeding goals. There are lots of positions for breastfeeding. A few of the most common are illustrated here. See what position feels comfortable for you. You only need one comfortable position to start. Later, you can try the others. Once your baby is in a good position, you can help them latch to your breast. Breastfeeding should not be painful. A good latch will help prevent nipple pain, help your baby remove milk from your breast, and tell your body how much milk to make for your baby. So in regards to breastfeeding positions, you should always be comfortable. You can use pillows, blankets behind your back, under your arms, and pillows under your baby. These things can be helpful in the early days as you are learning together. Always position your baby facing you with its ear, neck, and shoulder in a straight line. Support your baby's neck and shoulders. Avoid holding the back of her head. The baby's arms should be hugging your breast. When the baby opens its mouth wide, bring the baby to you, chin hitting first. Do not lean in. When the baby is correctly positioned, the baby's nose will touch the breast. Make sure the child is in a good position to latch on to the breast. In every position, remember, chest to chest, chin to breast. These are some of the most common positions to start breastfeeding: the cross cradle, the football, the cradle, and the slide lying hold. A few extra tips to latch. So before latching the baby, hand express, which is where you pump out the milk with your hand onto the nipple for the baby to smell and taste. Support the breast by forming a C or a U shape with your hand and place it behind the dark skin around the nipple or the areola, which can be seen here. If the baby's bottom lip is curled in after latching, gently pull on the baby's chin with your index finger in order to help the bottom lip curl out. So, a good latch. This baby is about to go in for a good latch. When your baby is latched well, his mouth will be wide open with his lips curled out. A large portion of the darker skin around the nipple will be in the baby's mouth, and the tip of the baby's nose and chin will be touching your breast. You'll feel a deep tug when the baby sucks. It should not hurt or pinch. You may feel tenderness in the early days as your body adjusts to breastfeeding. When your baby comes off the breast, your nipple should be round, not flat or pinched. If the latch does not feel comfortable or the baby is not getting milk, then place your finger into a corner of his mouth between the gums to break the suction. Then try again. If you and your baby still have problems with breastfeeding, please call your peer counselor or UNC lactation consultants on the warm line. If your baby is getting milk, you'll experience a few signs. The baby is on the breast deeply and comfortably, like this baby here. When the baby feeds, you'll experience a deep tugging and see your breast tissue moving. Your baby's whole jaw should move while sucking. You can see milk on your nipple when the baby finishes, if your baby has received milk during the feeding. Massaging your breast while feeding can also help the milk to flow and keep the baby feeding. If you feel relaxed, tired, or thirsty during feedings, in the early days, you may feel cramping. These are all fairly good signs that your baby has received milk. If your breasts soften and feel lighter after feeding, especially after mature milk comes in, and your baby is relaxed after feedings. Lots of pee and poo is also a good sign that your baby is getting adequate milk. So, today we've gone over skin to skin, rooming in, feeding on demand, exclusive breastfeeding, and positioning and latching in order to give you and your baby the best start to your new journey. If you have any more questions, please feel free to reach out to the Women's Health Education Center at UNC Hospitals. Thank you so much and congratulations on your journey.